frustrated. I think I just want to take antibiotics. I'm like, You can hear it out there, but not here.
Well, hello, Wellness Warriors. How are you guys doing today?
Doing outstanding, Michael. How are you?
Well, I'm just doing great. Thank you. Michelle, how are you doing?
Awesome. Doing great.
You know, I'm glad to hear that. And I'm glad to be here with you guys today because, you know, can you tell by looking at me, do I exhibit any signs of any hidden infections perchance? Do I look okay? Are there any things that may silently be triggering autoimmunity within me, Justin?
Absolutely, yeah. So we talk about infections, hidden infections, or the obvious infections as one trigger of autoimmunity. In other words, infections in some cases can trigger an autoimmune condition, or most often it perpetuates it. It weakens your immune system. So a lot of folks don't think about those things when we talk about autoimmune disease. Most of the time their doctors aren't talking to them about those things either. So we look at triggers, really identifying and removing triggers. Infections are one of those things. They can really start to mess with people's hormone production, create a lot of inflammation in the body, weaken the immune system. So super important when we're evaluating our clients and working with them on lifestyle medicine that we understand if they have infections and if so, what they are and do we need to take care of them.
So what are some common infections people may contract? Some of these I cannot pronounce, even though like Epstein-Barr, CMV, Candida, overgrowth, and things like that. What are some? What are some others?
Yeah. So Epstein-Barr, just so people are aware of what that is, it's also known as the kissing virus. So most of us have that virus in our bodies. Viruses don't really die; they just become sequestered in the immune system, and so they activate when the immune system takes a hit, and then they re-express. Epstein-Barr is a perfect example. So a lot of folks know maybe they had mono or they knew someone that had mononucleosis. That's the virus. Epstein-Barr is thought to cause mononucleosis. Oh. And so people are 18 to 22, somewhere in that range, and they get really tired, really sick. They're in high school or college usually, and that's the first time they get sick. Later in life, you can get a reactivated infection or you can get a new infection. And so it can cause a lot of the same symptoms. That's one example. Epstein-Barr is pretty well known, thought to cause fibromyalgia, joint pain. So it's linked to a lot of other health conditions. CMV is a different viral family. Cytomegalovirus, just a different viral family, like herpes simplex virus.
Yeah.
So these are all just viral families. And then there's other types of infections as well. So you alluded to that we see a lot of gut infections in our practice. So a lot of folks have small intestinal bacterial overgrowth, or known as SIBO, and that's a secondary infection for a lot of folks who have hypothyroidism, Hashimoto's being the number one cause of that. So these are secondary infections, often not aware that we even have them sometimes, or we just don't feel good, but we're not putting the pieces of the puzzle together.
What about mold-related myotoxins or something like that?
Oh, those are huge. Yeah, those are another toxin. Those are kind of an environmental trigger you could think of, or a chemical sensitivity. But a lot of folks are living in moldy buildings, moldy houses, moldy bathrooms, may or may not be aware of it. They just don't feel good. They've been sick for a while, maybe feeling tired, achy, have acne, just feeling run down and not quite sure why. And so these are common viruses.
Yeah, I experienced that one time in my life when we literally had to move out of the house for like 6 weeks.
Yep.
They came and tented it and ripped out all the walls. There was black mold everywhere, and we did not feel very good.
Yeah.
It was not a good experience.
Yeah.
What about parasites?
Oh, those are friendly.
We love those.
So those are fairly, they're common, but not as common as a lot of people think. At least the people I talk to, they've been on parasite cleanses, but don't know if they actually have parasites. It's kind of a trend, I think, now to do the parasite cleanse and not have confirmation of the parasites. But yes, those are very common. People get those through food, unclean food and water. Sushi gets a bad rap, but you get them from a lot of other places. And the interesting thing, Michael and Michelle knows this, that there's a lot of evidence with parasites and autoimmunity. half of it I could show you is protective of the immune system. The other half of the literature says it's a flare and you should deal with it. So when we have a client in front of us who's autoimmune that has a parasitic infection, we have to weigh those pros and cons, and often it's coming back to how you're feeling. If you're having a lot of symptoms, your gut doesn't feel good, you have cramping and pain, we're more likely going to treat it. But there's a lot of evidence that shows that parasitic infections in particular can be immunoprotective. So sometimes we treat an infection that can actually flare an autoimmune condition.
Right, so they can trigger an autoimmune
A flare-up.
condition. Flare-up is a trigger?
Yeah, parasites in particular, yeah.
So what about chronic immune activation? It's just all the time.
Yeah.
Is that what do you do about that?
Yeah, so that's a differentiation between an acute infection and a chronic one. Chronic infections can go on for months, if not years, at a low-grade level. A lot of times, doctors will run the testing for it and often not investigate why your white blood cells are low. White blood cells being low on a blood test indicates something's been going on for a while.
Yeah.
And if they're high, it's more acute or more recent. So with folks we work with, it's usually chronicity. It's usually chronic infections that are really bringing their immune system down, making them sicker, or just contributing to the whole symptom picture. And so that can be a little tricky because sometimes you can have more than one infection. One could be viral, one could be bacterial, could be fungal. So,
that's great.
Yeah.
That just seems like a lot of fun.
Yeah.
You've got more than one infection. Justin, I know that you know this, but a lot of folks may not realize that we happen to have a lifestyle expert right here,
absolutely,
right now, today, Michele, and Michele knows that there's a lot of lifestyle factors that can contribute to this situation. You want to tell us a little bit more about that?
One of the ones that might contribute the most to just general, there's an infection there, would be your oral health. So how you take care of your teeth is really, really important.
Mm-hmm.
Most people don't realize how you leave the structure open for things to move about in the body if you don't have good gum health.
there's a whole oral biome, if you will, just like a microbiome. So yeah, to your point, there's a whole.
Yeah, absolutely. So good oral health is a lifestyle factor that you can make sure you're doing to take good care of your body and reduce the chance of infection. Also, stress. Stress, everybody has it.
Stress.
Yep.
Nobody has it.
Everybody's
has got
it.
stress.
And when we have chronic stress going on, where we're activated into fight or flight response on a regular basis, and we're never bringing our body back down out of that and getting it into a relaxed and healing state, we end up with it's harder to fight infections. It can dampen the ability for your body to, the T cells and the T reg cells. One of them instigates your immune system. The other one brings the anti-inflammatory response. And it kind of imbalances that a little bit when you're in constant stress.
So it's going to lower my resistance.
Mm-hmm.
Yeah, it'll lower your resistance.
Great.
Yep. Yep. Really poor diet. When I say that, if people are eating the standard American diet, a lot of sugar, a lot of processed foods, everything like that, that's a lifestyle factor that can contribute to inflammation. And when you're fighting an infection, you have acute inflammation. And that's a good thing. You want your body to fight the infection. It identifies it and it takes care of it. But if it's ongoing and you're constantly re-injuring your body with poor lifestyle choices, now you have inflammation that never goes away, and that does not help your immune system at all.
Processed meats. So I know that we were down in California over the weekend, and we stopped by. We were going to have lunch with the kids and everything, and we stopped by the sandwich place. We were going to stop there, and my wife goes, "Oh no, we're not eating any of that processed stuff." And so she's now on this kick. No more processed foods.
We got to meet your wife. That's great.
Yeah. and that's a good
She
thing.
wouldn't let us eat there.
Yeah.
We're not eating that stuff. So we went out and, just had a nice normal meal of sauteed grouper with a lemon butter sauce. Something simple.
Nice. Yeah.
Something simple. What about people that smoke and drink a lot?
Oh yeah, anytime you're using any kind of substances that, anything like even a food sensitivity, for example. So anything that to your point with the processed meats, anything that your body doesn't recognize and know what to do with can trigger the immune system and cause inflammation. So yeah, anytime you're overusing any substances like alcohol or other risky substances, tobacco being one of them, it can be a problem for your body to lower the immunity to things.
We were talking earlier about the overuse of antibiotics and antacids. I remember my dad he had a pocket full of antacids. He lived on those things. I see that that's not a good thing to do, is it?
Yeah, and Justin might be able to explain this a little bit better, but if you don't have the proper acidity level to break down the food that you have, it's kind of your first line of defense. If you eat something and our food does carry, problematic things, and if you eat something and the acid is not high enough in your digestive system to destroy what you don't want, and it gets through the rest of your digestive system, then you can potentially have a problem. And if you have like leaky gut or a problem with the lining of your gut, and that's closely connected to your bloodstream, and then you haven't broken something down, it gets into your small intestine, and then now you have a leaky gut and it can leak out into your bloodstream and wreak havoc with your immune system and cause a problem.
I'm afraid to go out of the house. So what are some lifestyle shifts and changes that we can incorporate to manage these hidden infections?
Yeah. Before I talk about that, I was wondering if Justin could speak to kind of the type of testing he does to identify these infections, because people tend not to be super motivated to make the lifestyle shifts unless they've got the evidence that they need to.
Yeah, a lot of times when we work with folks, a lot of gut infections manifest, and usually they've been to their doctor. Their doctor will call it IBS, irritable bowel syndrome, which is a term they use when they don't know what's wrong with you. It's usually an undiagnosed autoimmune condition like Crohn's disease or ulcerative colitis or an underlying gut infection. But a colonoscopy and an endoscopy, which is a scope that they use, those don't reveal these infections. So they often tell, oh, you're fine, there's nothing wrong. And they're like, well, there's something wrong, and you just haven't figured it out. But in any event, gut infections are a big one. We see a lot of those, whether they're parasitic infections or SIBO, which is a bacterial overgrowth, typically, again, secondary to someone not moving their bowels very often, because those bacteria, our probiotic bacteria, reside in our colon. And they will go up the GI tract unless they're forced downward through bowel movements. So if people go long periods of time without moving their bowels because they've had a concussion or a traumatic brain injury that's damaged their vagus nerve, which connects the brain to the gut, and they can't move their bowels well because of that, or they're hypothyroid, or they've just had a horrible diet for many, many years, you start to have bacteria moving in the wrong direction. It goes up instead of down. And so we test people frequently for things like that, whether it's a leaky gut, which it's called intestinal permeability. Leaky gut is not something most medical doctors really even understand or even acknowledge. It's just in the IBS category, I think, a lot of the times. But yeah, these are secondary infections that can happen because of our diet, because of what's going on with our body at a deeper level, our diet, infections, things like that. So we test people. I don't like to guess what's going on. We like to test. So we'll do viral testing if we feel like that's what's going on. That's usually from a basic blood test. We do a comprehensive blood test, and from that blood test, it gives us some direction of where we need to really focus. And so if I see someone's immune system is suppressed and we start talking, it's like, okay, I think you probably have an infection. It might be this, could also be this. So we start looking, and we do those tests, and we often find them, and then we take care of them. And it's another stressor on the immune system that people can sort of have peace of mind that's being taken care of.
So you guys do a much more thorough and in-depth test than just maybe what a regular doctor would do.
Absolutely.
Say, oh, you've got IBS, take this pill.
Yeah, that's
See
essentially.
you later.
Yeah, that's the difference. Is We're not a pill factory per se. We're looking for what's the source is, what's causing the symptoms. And that's really what, if people are willing to make the changes and take the actions to get healthier, they'll get healthier. If they don't, they won't. I mean, it's kind of that simple in many ways. We don't progress over perfection. If people make some changes consistently with their lifestyle, they're going to get better. And it's just a matter of what's the lag time between when you start and when you see the results. There's lag time, so we got to be patient with ourselves.
So what are some things that that your test may reveal that may not show up in another doctor's tests?
Well, perfect example is SIBO. SIBO is a breath test, so people blow into a tube. That's not usually assessed with primary or even your GI doc, your gastroenterologist. Stool testing is something we do, but comprehensive stool testing. So when people say, I got a stool test for my doctor, what they usually aren't told is that stool test was very minimal, and it was looking for 2 or 3 pathogens that might cause acute diarrhea. But there's a lot more out there that could be causing infection. So we do a deep dive as we get the scoop on your poop, in other words. Stool testing, SIBO was a breath test. We do some different blood testing too, viral panels, things like that. So whatever we need to do to figure out what's going on, we do it.
That sounds great. Yeah. So after we do all that, then we talk to Michele about lifestyle changes we can make. Is that how it works?
Absolutely.
Depends on the infection, yeah.
Yeah, and it really does. It depends on what's going on, and I really appreciate the clients that come to me from Dr. Lane, because that we're not just throwing spaghetti at the wall and hoping it sticks. We actually know what we're aiming at, and we're using protocols of supplements that can actually help heal that as well. But one of the things as far as lifestyle goes is I work on 4 things usually. One is sleep. And if you are not getting the proper sleep and you're trying to heal, your body won't do it. And there are many instances where it can be pretty complicated to figure out why people aren't sleeping. But one thing that I definitely aim at is just good sleep hygiene. And there's quite a few factors in making sure that you can fall asleep at night, making sure that you can wake up in the morning and feel really good. And I won't go into all of that right now, but sleep is really, really important.
Yeah.
Your gut health is sort of a first line of defense, and there's a lot of things that break down good gut health that give you leaky gut, a poor diet being one of them. So I really help people really learn what an anti-inflammatory diet looks like, and it's very geared toward the individual. There are many ways to eat and have it be anti-inflammatory, but the key factor is whole real food. We'll just start there, and then just anything that reduces inflammation. So let's just say somebody has a lot of issues with food triggers, and they're eating a healthy food that is not, it's inflammatory to them, even though it's considered to be a healthy food. So we're making sure they're eating an anti-inflammatory diet. And in the case of SIBO, it's going to be pretty low carb, because they need to create a situation where the bacteria doesn't get fed with their diet. So that's the other thing. And then I mentioned stress as a big factor. And so anything that supports getting you in a relaxed state, or that improves your vagus tone, or maybe addresses past trauma, anything like that. I work with all of that kind of thing. Just making sure that whatever triggered the situation isn't still there triggering it.
So like maybe walking after a meal or daily exercise, things like that.
Yeah,
will
that's
help
another
to do
good
it.
point. Movement. I mean, like if you walk after a meal, that's going to help. We'll talk about blood sugar dysregulation in our next episode.
We'll talk about that.
And walking after a meal really helps with that, which can help you feel a lot better and heal faster. But, just yoga, stretching, deep breathing.
Visualizing.
Yeah, visualizing. Keeping yourself in a really good state of mind where you're in a resourceful state all day, instead of like thinking about all the negative things that have happened to you.
That's
all
the
of
most
that's
important
really,
thing.
really good.
Yeah, your state, I think.
I have a sleep question, if we can jump backwards for a second. So I'm going to take the long way around that door. So I like to eat apples. I try to eat at least one apple every day. I find that helps with my digestion. I feel better. And it just kind of helps to keep me moving, so to speak.
Has some fiber in
Which
it.
is a good thing.
Yeah.
So the other night I came home a little bit late and I didn't have my apple. So I ate my apple. It was like 10:30. I found I should not have eaten my apple at 10:30 because of all the sugar in that thing. It totally disrupted my sleep. I was awake till 1 o'clock in the morning watching Japanese monster movies trying to go to sleep. So is there a time frame when we should actually like not eat at all, or certain things we shouldn't eat after a certain time at night in order to get a good night's sleep?
And that varies between individuals
yeah.
as well.
Mm-hmm.
And in our next episode, when we talk about blood sugar regulation,
Oh
we're
my
going to hit that subject hard.
Oh,
Because, yes, there are things you can do or
Okay.
not do at night, at times, and at different times that will make a huge difference in how you sleep.
Okay, well, I'm glad that I teed that one up for the next podcast where
Yeah.
we're going to be talking more about ways to keep your immune system strong, your defenses up by addressing your blood sugar regulation. Michele, Justin, thank you very much. We've had a great time today, and we hope to see you guys again soon with another exciting episode of the Wellness Warriors.
Idea about the time. There's no clock. Like how long the episode? Oh, okay, there.
21 minutes and 30 seconds. It's kind
about-
of dead on.
That's about right on. Yeah. It's a miracle to get here at 5:30.
We didn't go 35
Are we
minutes.
talking in a bad spot? I don't know.
No, I think we're fine. I can't hear, but I'm presuming that the